welcome to this meeting about the fillers, and about this new filler with a new concept, with a new vision of how to build a filler and to have a safe and effective filler. My name is Pittoni. I'm an Italian dermatologist working about aesthetic medicine and aesthetic surgery. And one first curiosity about the aesthetics is what is the first impression? The first impression is something that when we meet a person for the first time, just looking in the face of the person, we have the impression of a certain personality. So it's not only aesthetics, but in our mind it comes the impression of a certain personality. And such impression, based on the physical aspect, not only persists, but tend to consolidate. So it's very important. About this guy, for example, looking this picture of this guy that we don't know, which is my first impression about him. So the aspect could like or not, but looks timid, look unconfident, look unsecure. Maybe if he's not or not reliable, is it competent? We don't know. This other guy, maybe it's nice looking, but looks something a successful person, brilliant, self-confident, competent, intelligent. This is an impression, of course. But as you can see, it's exactly the same person in this case, for example, after surgery. And so this suggests how important is the look of the person, just to give an impression of a certain quality of person that maybe is not truth, of course, but the image is strongly important. So what our patients want, they want to improve their self-image, they want to rejuvenate, and they want in the end to be beautiful. So one of the most important gun in our hands as doctors are for sure filler. Why filler? Because filler is the most effective. Also, if you compare to any other procedure we have in our hands, like laser or peeling or masks or what else, this is for sure the most effective. It's the fastest and is also to obtain the best patient compliance and also the best cost-benefit ratio. And also the best way to customer loyalty. So we have to understand that we need to keep our patients, not only to do one session, but to have this patient for the longer time that is possible. And filler is the material that allows us to obtain this kind of goal. So in the last 15 years, the concept of the soft tissue aging has changed. Now we understand that the really central moment of aging is not mass or muscles related, but depends mostly by a soft tissue atrophy. We compare the ball empty and full, and also we compare to the valve of the fruit. And so what we see in the aging phase with the years is that we have a reabsorption of a lot of different structures. So we have a dermal atrophy, a lipoatrophy, a muscle atrophy, and what we discovered in the last years is also bone and cartilage, we have an atrophy. So a biometric volume loss is introduced with an aging phase. This volume loss caused by descent or loss of facial fat pads depends, of course, on age, genetics, and weight of an individual. But in general, it starts in women at 30 years old, and they calculate that every year a woman tends to lose 4 or 5 millimeters in the face of fat per year. So this could suggest, in an easy way, of course, to say that every woman would suggest 4 or 5 millimeters more of filler or something of substance to sustain the face. What happened to this very famous, maybe one of the most famous actors in the world? We see a lot of difference, of course, but what really happened? In these points here, we have a lot of volume loss. You see, comparing the other side, in these specific parts, we have a lot of volume loss. And then, consequently, we have a descent of the tissue in every single detail indicated here. And so the result you see that is the complete change of the face, of the expression in each single point. So there are changes of the soft tissue, especially in this area indicated in these pictures. And these are the area where first we have to consider how to fill and to replace the volume loss that we have. You know, in Europe we can find more than 100 fillers, but it's very important that we select a nice filler for us, for our activity, because also the quality of filler can decide the quality of our work, of our job, of our results, and so in the way we keep the patient for us. So the ideal filler have a lot of characteristics, like non-pyogenic, non-antigenic, to be stable, biocompatible, easy to use, not too expensive, non-allergic, not toxic, and in the end safe. And also the long-lasting results, because now we understand that we don't have to use anymore the permanent filler because we see a lot of trouble, a lot of problems with them. And so we need now the biological filler, but with long-lasting possible results. So a biological filler, the most used now in the world is the hyaluronic acid, because we understand the hyaluronic acid is unique in the nature, so we don't need any test. We have the same hyaluronic acid of animals, of plants, of vegetables, and so on. So this is for sure the more safe and effective filler we have. But there are so many and so many different, because we can obtain it by derivation of a bacterial origin or from the crest rooster. And also we can obtain it in different molecular weights. And this is very important because we need also different concentrations and different level we can decide to inject the material. So the pure hyaluronic acid is in theory, the more excellent, the more perfect filler. But if we inject it directly in his pure aspect, we have a very, very fast absorption, and we need them long-lasting. So to obtain a long-lasting results, we need to stabilize it. Also because temperature is against us, so the hot temperature creating more fast absorption. More of the other things, the hyaluronidase, this enzyme that we normally have in our derma, is the one that promotes the reabsorption and the change of our hyaluronic acid, the natural one, and also any kind of inflammations, mostly by free radicals, is also another factor that creates the degradation of the hyaluronic acid. So to obtain these long-lasting results, we use a technique that we know for many years now, that is the cross-linking. The cross-linking is just working against the thermal degradation, the hyaluronidase effects, and the effect of free radicals. But we have to use something to obtain this cross-linking. And the most used reticulum agent we use is BDDA, the formaldehyde that is not used anymore, it's just more an historical point of view, and the divinyl sulfone. What's the meaning of these different kind of materials we use to obtain this cross-link? The divinyl sulfone now is the more interesting cross-linking agent we have in our hands now. Why? First of all, because of his characteristics. So it's very important to know that this data, that is the molecular mass. So it's smaller, it's almost half comparing BDDA. And a smaller mass creates the formation of a denser and smaller reticulum. This is translated in a safer and long-lasting effect. But yes, long-lasting effect, I appreciate it very much. But what's really important is the safer, because when you inject, especially when you inject a lot of times in the same area, in the same patient for years, of course the part of the hyaluronic acid is completely absorbed. But something of this reticular agent rest remain. And after years, or in some particular patient with some tissue very sensible, sometimes we have a very bad effects because this is not a natural material, and this one can cause a reaction of the skin. And especially sometimes when we inject, for example, a stronger BDDA, hyaluronic acid, too superficial, for sure we have some granulomas, we have some very inflammation for days and days, and it can hesitate in a granuloma sometimes so big that it's very difficult to treat, and sometimes we have to reduce it in a very small surgery way, and that's not, of course, a nice thing for our patient. So the BDDA, it is the butanoid C, D, and D ether, is still the most used reticular agent. Why? Because it's cheaper, and it's very, from a chemical point of view, it's much easier to use. So we have an easy material, cheap, but this residual creates, as I told you now, these granulomas that sometimes are really, really very bad, like especially in the softer tissue area, like the lips, and so you see this kind of granuloma that can survive for many, many years, and sometimes I can say forever if you don't treat them. And the treatment of these kind of granuloma can become really, really very difficult, and in the end sometimes we have to use a small surgery to remove it. But that's, as you can understand, is not a thing that we can think around our patients. So in my patients, what I prefer to use is a hyaluronic acid filler, reticulated of course, but with this dividend sulfone. Also because the absorption of this material is quite complete, and we know that there's not any interest in general circulation. So the complications are really reduced to nothing, of course, comparing the correct technique and so on. But the quality of this material become the quality of my job. The injection technique, of course, is also important because the hyaluronic acid particles must be adapted to a cellular matrix. So if we have a high molecular weight, we have to inject very deep, maybe really in contact to periosteum. When we have a medium in the deep derma, and of course we need a very low molecular weight to inject the superficial derma. So never do the mistake to obtain longer result to use a very big molecule in the superficial part of the skin. Another question is anesthesia, because of course we have a needle or a cannula in our hands, and so sometimes the patient suffer from it. So the question is, use anesthesia, yes or not? Of course, the patient asked to suffer the less that is possible. We have some cream local to do a sort of local anesthesia, but the cream are effective just a little bit, and just maybe only for the moment that we pass through the dermis, but when we inject the cream will not work anymore. Sometimes some patients ask for a truncal anesthesia, or sometimes we can just add some lidocaine. Sometimes I do it in the lips. I mean, the first 2 drops I inject are lidocaine that you can use 1 or 2%, and after you inject in the same syringe the filler as well. I prefer to do this and to have a filler that is free from lidocaine, so I want to have the possibility to decide if I want to use this kind of anesthetic or not, because some patients are also sensible to lidocaine, so they prefer not to be injected by this kind of molecule. Dilution, well, normally I don't use any dilution in the use of my filler, but this must be considered in the periorbital area. Periorbital area is area that, especially in the last years, is much more requested, because now people study and see the image, is starting to understand how important is the orbital area in the appearance of the face, and so they ask more and more for injection. But this area is a very difficult area to inject. Is is not a safe area to inject, so you must be very expert. And more, if you inject, of course, an hyaluronic acid pure, sometimes you have edema reaction that can last also for 2, 3, 4 weeks, and it's not nice for the patient like this. So in this area, my message is to be very safe, to have a dilution, and not to try to obtain the results at the first moment, because sometimes you obtain an overcorrection with no intention to do it. What about massage? In my job, in my work every day, always I suggest massage, because the most we distribute the filler, the more effective, the more natural, and also the risk of a sort of concentration, and so a reaction of the skin against this concentration of material is possible. So we have to understand always to do first of all the massage by ourselves, and then to suggest patient to do massage at home just for the first day, because going on for the next days is a nonsense, also because you can maintain a sort of inflammation that you absolutely don't want, don't need. So the contraindications about the fillers, of course, are pregnancy and breastfeeding. Also, if the meaning of this that we don't have any scientific work about it, but of course the logically that we don't have any problem also in this condition. But anyway, the autoimmune disease, because they can stimulate a sort of reaction against the material, the cancer of course, and also the patient with hypertrophic scar tendency. And this is, of course, against the BDDA, is the worst things to use in this kind of patients, because in this kind of patients you stimulate a sort of scar reaction, and sometimes when you have a hypertrophic scar reaction, the risk to have of course a superficial, but an inner scars that can translate in a granuloma becomes really high. The most frequent side effects that we know, of course, are edema, redness, edema, swelling, hematoma, but all things are absolutely solvable and, let's say, normal. Of course, the infection is something that we have to avoid, and sometimes we think that since it's a clean procedure, it's easy not to have an infection, but sometimes it is. Also, if we don't learn how much important is to clean very well the skin before injecting, because with a needle you can bring in the deep of the skin some particulars, details of a cream or a powder, things like that, and create reaction. Sometimes you think that the reaction is against the filler, but it's not, because you did not clean the skin enough, and you bring something in the deep and you have a reaction. So we have to prevent all these kind of side effects, and most of these side effects are available, but the prevention consists in the correct injection technique, the correct injection site, and the correct patient selection. But above all, we have to have the correct, the best product selection in our hands, and also to have also to be recognized by the quality of the material we use. In my opinion, it's a nonsense to use a very cheap material, also because we have to think that our patient have to come back. That patient must be my patient forever, the more is possible. So the filler complications are mostly related to missed expectation by the patient sometimes, and the complication related by the product. And the technique also, of course, is the base to start doing this kind of job. So the prevention of infection, the so-called biofilms, that is the new theory that these biofilms can create around the filler, is absolutely available very easily with a proper standard of care. Cleaning the area by antiseptic solution every time, never forget, never be in a hurry, do this in a very correct way. It's easy, it's fast, but it's very important to prevent any kind of infection. Also, if it's a small infection, sometimes the patient becomes really disappointed and will not come to you again. So you must be perfect in every single step, and also this requires very short time to do it correctly. What we really afraid in this technique in general is the embolia cutis medicamentosa. So we have to be very careful to not inject anything inside any vessel, especially in any artery. And to do that, first of all, we have to know very well the anatomy, and not all the colleagues are thinks the same of what I'm saying now, but especially when I inject deep in the face, I always do a very short aspiration of the syringe, because when I'm deep, I never am sure where I am. So sometimes, maybe it happens one time in your life, but one times really you create a very bad situation. So maybe you will lose 20 seconds more than usual, but do this. When you are deep, do always a little aspiration to be sure where you are. Of course, if you have a needle with a cannula, the problem here is not existing. You see, this is a result of a skin necrosis after dermal filler injection inside the arteria. So all these parts change the color. This is the first sign you have that this color becomes, now the color is not perfect, but it becomes a little violet, let's see, and then it starts to have small bubbles with the pyogenic infiltration, and then you have a necrosis, and then you have a scar, and you have a permanent scar. So this is a thing that you must be very careful. And also we will see later, in the new technique when injecting above all the nose, this kind of side effects are more and more common and very bad, because especially the nose, the scar of the nose creates a damage to all the image of the whole face. And in general, when the situation is necessary to do it, I prefer to use a cannula in deep injection for the reason that we see before, the embolia, and also for the hematoma, because also this could see, yes, the hematoma is dead, and in 4 or 5 days, 1 week it will pass, but the patient will not be happy about it. And sometimes you can lose a patient for things like that. Also, if you explain that it's possible, that it's nothing bad, that it's normal, but the patient is not happy. And so you must avoid everything that makes your patient unhappy. So if you are deep, in my opinion, it's better to use a cannula, especially if the patient have a history of any problems, very fragility of vessels and things like that, or problems of coagulations and things like that. So now the cannula is a very nice gun we have in our hands, and so now I use the cannula more than the needle, generally speaking, because most of my fillers are deep, and so what I absolutely suggest is to think always to a cannula in a deep injection. And now about difficult area we were speaking before. Also, for example, you see the periorbital area. When you finish your procedure, you appear to be perfect, but after a couple of days, this is the result, because the edema here is 5 times more important than any other part of the face. So you create an overcorrection because for example, you inject pure hyaluronic acid a little bit too much. So be very safe, be very take a lot of care about this area, because this edema can last also for 2-3 months, and also the patient will be very disappointed about this area. And of course, in this area, cannula only. We have to consider the anatomy of these things, of these vessels, because these vessels are, as you can see in a real anatomy image, very big. and so it's not so impossible to inject an artery like this. You see especially the angular artery, also because this area is very, very common to be injected for this kind of the problems, the aesthetic problems we have in this area. And also, you see how big it is, and it goes exactly in the area we are used to inject. And of course it's deep because it's close to the bone, but it's really not impossible to get inside an artery like this. You see another detail of also the area of the cheek, and how in this area in particular this zigzag so concentrate the artery in this point, and so it's also easier to have, if you are lucky, an hematoma. If you are unlucky, really embolia. Another detail, also around the area of the nose, that now we inject more and more with fillers. I'll show you some case that now that we can do really fantastic jobs with the filler in the nose, but also the pressure of the artery in the nose is very, very high, and so they are also very well dilated, so it's very easy to inject an artery in this area also. So we must know how we are built, so before we decide to inject in an area, we also have to consider how nerves, how muscles, how different fat pads are involved in the area we decide to inject. As you can see in this image, immediately after, below the skin, we immediately find a fat pad. These areas are very safe to be injected, but not everywhere. And also this helps us to decide in which area and how to inject, because all these fat pads are in separated compartments. So we cannot inject in an area without knowing how is designed the fat pad, because sometimes we obtain a different result. So considering how they are built, we can decide how to follow the design, the nature made with the pad, and if we want to improve it, to augment it, we have to inject exactly in the right area and in the right fat pad in the face, especially in the cheek. That is one of the most difficult areas to correct, because sometimes if you don't do the right correction, you create an asymmetry and you create a projection that could not be nice for the patient. So you see that we have different layers of this fascia. And don't forget this, in this area here, just in a line going down from the central area of the eye, there's the most important nerve of the face. Usually this area is not so common to be injected, but sometimes it's used during the inferior part of the periorbital area, and you must be far from this area because of the nerve and of the artery that comes out together in this particular point, and always to be avoided. Also, of course, we know this area, when you want to do a truncal anesthesis, that is the nice place to inject the lidocaine to have a good anesthesia about the upper lips. So there are some areas where the nerves becomes bigger and becomes more important, and so sometimes also if you have only a needle in our hands, sometimes be in the really wrong place is not good, because you can create a lot of pain and a lot of paresthesia, also if it's not, of course, permanent to the patient. So be also very expert in recognizing the place where you have to go and not to go, also because you know that always together with the nerve there's an artery and a vein. So the treatment of the patient, remember this will never be a standard treatment, so you never have to do the same thing in two different patients, but you have to understand which kind of face is in front of you and individualize the treatment of the patient the more is possible. So that will be your originality, that's your ability to do this job in a perfect way. And always run after natural effects. Nobody of us is so good to invent a better result in nature. So always, and also the patient also sometimes tends to ask you for something special, but always go around a natural effect. For example, these are mother and daughter. I don't know who is the more beautiful, because also here, of course, the mother had a lot of treatments, aesthetic, a lot of filler, but you know, it's very balanced, it's very well done, and so the result is very nice. So you must be the one that decide how to do the job, and not to be influenced very much the patient. The patient, of course, have to ask what they want, but sometimes you have to be also able to suggest the right approach, because if you do the things that are not natural, it's a sort of sign that you do on this patient, and you, doctor, will be recognized because you do, for example, exaggerate the results to a patient, and it's not nice for your image, for your work. So, in general, we all know that the deeper we inject any material filler, the more filler, the more material we need. So, also when we decide how many syringe to use, we have to consider, first of all, how deep we want and we have to be in this kind of patient. And remember, and also in the mind of patient, the less pain you create, the best doctor you are. And if you never do an hematoma, you are a very, very good doctor. Sometimes this kind of thinking comes before the results in some patients. So we have to also to take care about this kind of approach with the patient, because your patient must become your forever patient. We were speaking at a congress last month in Italy, it's enough to have 50 good patients in your job to survive. So that's why you have to create your forever patients, doing all the good and right things for him, because the patients want results and want to have also not only a doctor, but also have a friend that suggests how to do things, how to improve the image, because sometimes they don't realize the exact problem where it is and how to reach it. For example, about the lips, sometimes the patient comes, I want to do a bigger lips, but it's not enough. We have to do a sort of analysis of the lips and calculate how a perfect lip should be, and so always go around a sort of model that could be, of course, different in different kind of people and in different race and in different color of the skin. But as you can see, these little points and this 1.5 ratio between the upper and the lower lips are the most important things always to follow. And for example, in older people, when sometimes they need more support in this area, the injection of the filler must be absolutely very deep in this area to obtain an inversion of the lip margins in a very natural way. Because if in a person of 70 years old or more, you try to inject directly a lip, you obtain something that is unnatural 100%. So the right area to inject that could be associated with the lips augmentation if there is a really atrophy, but otherwise you inject in this area, I will see some results. To sustain the lips area is absolutely this one in a very deep way, very close to the muscle. Of course, lips are not the same have not been the same in the history. In the last century, you see how lips has changed. So there's a fashion also around sometimes things like around filler the lips. So the different actors represent different approach to obtain good results. But doing different kind of lips. But in general, remember this number. So if the proportion between the upper and the lower lips must be 1.5 or less. So never create an upper lip bigger than a lower lip, because the result will never be nice. Also, if sometimes some patient comes, because in their mind there's also the interest to feel the upper lip upper. But when you follow them and you do that, they realize, no, doctor, this is not what I want. Yes, because you have to suggest that this is the nice, the golden ratio for the lips. So in these last years, that for the more expert aesthetic doctors, we have a new area that we learn to feel. They are more difficult sometimes, but also we learn how to improve the aspect of the face in this particular area that sometimes the patient do not ask, because they say, I want to improve my face, but they don't know how. For example, a patient like this comes asking for a blepharoplasty. Blepharoplasty in this case is bad, it's a nonsense, it will have horrible results, but instead the feeling of this area, for example, is the way to obtain a better look of this appearance of the periorbital area. The lower lid is one of the area that now is most requested and is one of the most difficult, because sometimes the blepharoplasty cannot solve any problem in case like this, and sometimes comparing, for example, 10 years ago, 15 years ago, when in a case of an old lower eyelid, we tend to do in 80% of patients a blepharoplasty. Now we do maybe in 20% of blepharoplasty, because we have really a lot of skin. But now mostly we prefer to inject to give again the volume to this area, because sometimes the blepharoplasty, yes, correct the skin, but the result is an older face. Another very important area to be injected is the lower jaw, because also this is a help not to avoid the facelift, the lower third facelift, because sometimes just correcting, we will see some cases later, just correcting this little area create a sort of fog, let's say, again the quality of the skin in this area, and so we see a continuous line, so we don't appreciate the aging and the descent of the skin in this area. And in the end, the nose, I would never expect 15 years ago that we could do a job like this, but now with the fillers, we have a lot of new studies, we have books speaking about the place of the medical rhinoplastic with very, very nice results and more long-lasting results. Actually, we still don't know why, but the hyaluronic acid in this area, correctly injected, sometimes after the second, third times, have results that could last for years. We don't know why, because of course there will be a reabsorption, but for some reason our tissue create again new hyaluronic acid in this area, and sometimes we have results for many, many years. So the technique is really very, very interesting. So, Revitajal. This is my everyday filler. What is it? Is it dermal filler, of course, CE certificated, made by reticulated hyaluronic acid, by a biotechnological origin. It's now the line is very complete, so we can feel from deep to superficial wrinkles, any skin defects, also the small scars, and the superficial technique is very nice for the lips augmentation, for the face contour. Also now for the most requested in Europe, the vaginal correction, also to rejuvenate this area. Also this filler is very nice, also because without the BDDA in this area, we avoid a reaction of a mucosa area that is very delicate. And this product is burned by an Italian research and developed and built 100% in Italy. So we know exactly the origin, where it's done. It's in northern Italy, it's close to Bergamo. It's very well tolerated, is endotoxin free. The concentration of hyaluronic acid is very high and is reticulated by this divinyl sulfone. And I would say that is now the number one, the best filler with divinyl sulfone, because it was the first, and when we developed in these 15 years together a lot of improvements to this product, and so now the standard of this product also in Italy is very, very high. I use it now. It's my number one filler in my hands in my practice, and since I use it in the most difficult area, it's come the only chance I have, because especially in the periorbital area, when I have to do something very delicate, very, very difficult with this filler, it becomes really much, much safer. So the innovative production process is what makes the difference, because this system guarantees a totally sterile preparation, avoiding the final heating. So it means that when we build the product, and they build the product, if you start from the beginning to build the product in a very sterile way, you don't need another sterilization to the end. So you don't need to give this kind of treatment to the material. You leave it more natural, and this translates in more and long-lasting effects. This hyaluronic acid selected comes from a patent method based on the biofermentation of a bacterial strain, so very well known and very well developed. So word number one about Revitajal is safety. So high purity, nucleic acid and protein, very low concentration. The bacterial endotoxin rate is below 0.2 euro per ml. Definitely is below the European pharmacopoeia limits for injectables. And so all this reduced to minimum the sensitization reaction, and also the short time reaction that also we wanted to avoid around the product and filler like this. So now we see some case studies, of course, with the product for also difficult and more important area. You see this area, for example, in this patient, asking for a blepharoplasty would be a very bad choice. In this case, you see that filling this area with the hyaluronic acid, you give an appearance to this area much more natural, much younger, much more healthy as an appearance. And of course, my suggestion is always use a cannula in this area, because it's very delicate, and we are close to the area indicated here. We are very close to the nerve of the central part of the face, so be very careful, but see that the results in this place is very important, much better with the filler than a blepharoplasty. So little detail of a nose in this case, and in this, for example, perioral area, you see that correcting little details, the appearance, the global appearance of the face really become softer and younger. This is what we were speaking about before. So how to improve an area in a very natural way without any infiltration of the lips, but just to rejuvenate the area. So we don't, in this case, the patient didn't want to have bigger lips, but just rejuvenate the area to create a more natural appearance and younger, but with the small lips as before. But you see that our area is very is much more natural, is much more is much younger, and with no infiltration of the lips. But in this case, the infiltration of the Revitajal must be submuscular in the fat pad in this area. Another case like this, you see also the mid-face, how is improved with the injecting the fat pads in this area, or in this area, or in this area, without doing the effects of the big zygomatic hair that is not nice, also if the fashion now, but you have surely a much healthy face in a very natural way. Also in this case, you see the periorbital area very, with also the quality of the skin, the color of the skin, with the filler very well injected, changes, improve very much. Also because it's very transparent the skin and giving a good layer of filler or hyaluronic acid, allow you not to see the structure transparent under the skin, and so the appearance of the skin is much better, is much younger. Also in this girl, asking for a blepharoplasty, we do the exact opposite of a blepharoplastic here, because we decide to fill the upper lip eyelids, just to obtain, you see, a much more nice appearance of the face in general. You see, it's not always, sometimes it's not important a detail, but the result in general you obtain. So filling all this orbital area translates in a much younger, in a much nice, in a much healthy face, and what we want to obtain in a patient, also young patient like this. You see another detail. So how is important to study in general the appearance of the face and have a correction in some key points that in a patient like this would never imagine. She just asked to improve, but how, a blepharoplasty, yes, not, I don't know. So you must be, in a case like this, the one that decide and do the right suggestion to improve the face. So first of all, we have to look at the face of our patient very carefully to decide how to inject, where to inject or not inject something. So you see how to fill this area also from this point of view, improve the image of the face in general, and have it change really the look of the face in a very natural and soft way. Other details again, like before, to fill this curve, to improve the contour, we're using just filler in a face that, of course, would request a facelift, but not all our patients want to undergo a surgery like this. So with the filler, you obtain, in any case, natural and nice enough, in my think, results. Also because you have to make your patient understand that you want make them really younger, but they give it their age in a very well standard. Again, the same patient, you see how this line, the contour is really improved with some key points injection. And now the nose, you see, sometimes with our colleagues we call this a miracle, with a filler, because this result is not easy to obtain by a surgical rhinoplasty. But you see, they injecting correctly this area and this area, we create a different corner here, a different angle, and a more continuous line of the surface of the nose, and you also have to sustain this point some more, and you see how the nose appear completely different with no surgery. So you see the key points to inject in a nose like this. It is a difficult nose from also in the hands of a very nice plastic surgeon. From a surgical point of view, it's not an easy nose to do, but with a filler it becomes really very good results, in my opinion, in a 10 minutes procedure that if it's made with expert hands, so take care of all the things I told you before, is absolutely also an easy technique. Also in a man, you see also a very heavy nose, the correction more or less in the same key points, more concentrated in this case in this area to sustain all the bone area, let's say, of the nose that is not perfectly built. And in the end, let's say the so-called vaginal trend we have, so now we feel a lot the big lips of the vaginal area that is more and more requested. So in a word of full copy, you have to do absolutely an original and give a sign to your job and be really show that your patients are natural, have good results, and you don't have to try to invent impossible things, but with this kind of approach you will keep your patients. Thank you very much for your attention.